tensor fascia latae, or the TFL, is that muscle that comes around the side of your hip and down almost toward the back. So you'll be leaning onto your hip and moving your body slightly sideways. And you'll want to try and roll in between the pelvic spine, or the high girdle area of the pelvis, down to that greater trochanter, or that hip bone that pokes out to the side of your body. Rolling down into it and back into the pelvic region there. There may be some tenderness throughout that whole region, as the muscles around the pelvis are often quite contracted. Take your time rolling out, and of course you can have this leg supporting your weight a bit more. For higher intensity, if you really want it, you can take that other leg and lay it on top of the one that you're rolling, so the weight of that top leg can press down into the hip more.